Well, I'm Narendra Rana. Good morning. So, topic of the day is insurance coverage for rural India. Insurance coverage for rural India. Only half of the rural households have government health insurance, while 34% lack any health insurance coverage at all, and 61% of those surveyed lack life insurance. So this is coupled with limited access to diagnostic facilities and affordable medicines, further posing challenges to this cohort, notes the State of Healthcare in Rural India 2024 report released recently. The survey was jointly undertaken by the non-government organization Transform Rural India and Development Intelligence Unit, which works in the healthcare sector. So only half of the rural households have government health insurance, while 34% lack any health insurance coverage at all, and 61% of those surveyed lack life insurance. So this is coupled with limited access to diagnostic facilities and affordable medicines, further posing challenges to this cohort, notes the State of Healthcare and Rural India 2024 report. Additionally, only 12.2% households of the survey have access to subsidized medicines from Pradhan Mantri Jan Aushadhi Kendra, while 21% lack a commutable medical store. So the study revealed that there is a lack of diagnostic facilities in rural areas, mostly because of the shortage of trained personnel. Only 39% of the respondents confirmed that there was a diagnostic facility within a commutable distance from their village, where they could visit only for blood test or medical imaging. However, 90% of respondents do not get a routine health checkup done on their own wish, unless and until the doctor suggests them to do so. The accessibility to affordable medicines at government medical stores is a challenge for the rural population. As per the report, only 12.2% respondents have access within commutable distance from their villages. So the report further notes that 73% of the households with elderly members need constant care, and the majority, that is 95.7%, prefer family caregivers, predominantly female, 72.1%, highlighting the need for caregiver training on home-based care. So engaging an external caregiver as a paid service does not seem to have a great deal of traction in rural India, with only 3% of such households ever having opted for the same. Only 10% of the households rely on neighborhood support in the absence of family caregivers. So the caregivers for pregnant women include husbands, 62.7%, mother-in-laws, 50%, and mothers, 36.4%. In both cases, there is a need for a strong social network and supportive environments, and a need for capacity building for family members. So access to quality health care has always been challenging for rural India, which comprises more than 70% of the total population. So whether it's a viral infection, critical illness, or an accident, India's rural population is vulnerable to various health-related risks. Even though India's rural population makes up a massive opportunity, or massive proportion of the total population. For the low penetration of health insurance schemes proves that the market remains largely unexplored. So, be it due to a lack of hygiene, lack of good medical facilities, or proper nutrition for those below the poverty line, the rural part of India faces numerous challenges regarding the health insurance in rural areas. Most rural households lack the concept of structural savings, which leads them to a situation where one has to choose between health and financial stability. If the health insurance premiums are too high, the rural population might rethink the idea of buying insurance policies for themselves and their families. As the kind of health insurance schemes offered to this untapped market becomes crucial in helping increase penetration. The Government of India has launched several health insurance schemes for the rural population to deal with various healthcare issues. Say some of the health insurance schemes like Aam Aadmi Bima Yojana. The Aam Aadmi Bima Yojana is one of the rural health insurance schemes introduced by the Government of India to provide social security to landless households and families below the poverty line. The scheme is meant for beneficiaries involved in certain vocations, including fishing, weaving, carpentry, etc. The Aam Aadmi Bima Yojana offers life and disability insurance to the beneficiaries and partial compensation for the loss of wages due to death or disability. Apart from insurance coverage, the scheme provides scholarship benefits for the education of the children of the insured. Since its introduction, the scheme has provided financial assistance to rural communities and reduced economic vulnerabilities associated with healthcare emergencies. The another one is Rashtriya Swasthya Bima Yojana. The Rashtriya Swasthya Bima Yojana scheme, an acronym for Rashtriya Swasthya Bima Yojana, is a health insurance scheme for providing assistance in rural areas. The scheme was launched in 2008, especially for people working in the unorganized sector. It is estimated that almost 93% of the total population of India works in the unorganized sector. Hence, the scheme was introduced to bridge the gap. The scheme gives hospitalization coverage of up to rupees 30,000 annually for a family of 5. So one of the key advantages of availing of the RSBY scheme includes its cashless facility, where the beneficiaries do not have to pay upfront for medical services under the scheme. So the scheme also provides coverage for transportation costs, making it effortlessly for the insured to reach healthcare facilities in remote areas. Then the Pradhan Mantri Jan Arogya Yojana. The Pradhan Mantri Jan Arogya Yojana, also known as the Ayushman Bharat or National Health Protection Scheme, is one of India's largest health insurance scheme that gives coverage against secondary and tertiary hospitalization charges. So the scheme covers up to rupees 5 lakh per family per year with cashless transaction at both public and private hospitals. The Pradhan Mantri Jan Arogya Yojana schemes covers a wide range of medical conditions, including pre-existing ones, ensuring comprehensive health care insurance for rural areas in India. The scheme also promotes a paperless and cashless mode of transactions, and that ensures transparency and efficiency in healthcare delivery in every part of the country. And then Pradhan Mantri Suraksha Bima Yojana, with an aim to enhance the healthcare insurance penetration in India, which was only 20% in 2016. The Government of India launched the Pradhan Mantri Suraksha Bima Yojana. The scheme covers individuals between 18 to 70 years with a saving bank account for accidental death and disability. So the health policy provides accidental death and disability of up to rupees 2 lakh and a partial disability of Indian national rupees 1 lakh against rupees 12 per annum. So the premium amount gets deducted from the beneficiary's bank account through the auto debit facility. Then there is Universal Health Insurance Scheme. The Universal Health Insurance Scheme was launched in 2003 to support the poorest sections of the society. So the UHIS scheme was launched as a part of the Universal Health Assurance Mission and is open to offering healthcare assistance to people living below the poverty line. The UHIS scheme can be purchased by both individuals and groups aged between 5 to 70 years. Accidental disability, hospitalization, and a lot of other facilities are covered under the UHIS scheme. However, the health insurance policy premiums depends largely on the size of the family and the number of individuals insured. People in rural India cannot afford regular health insurance policies due to many financial and educational limitations. So, with feasible premiums and substantial insurance coverage, the various health insurance schemes or introduced in rural areas by the Government of India are aimed at providing health insurance to every citizen of India. The various health insurance schemes by the Government of India have played a crucial role in extending healthcare access and financial protection to marginalized communities. So recently, the State of Healthcare in Rural India 24 report released by NGO Transform Rural India and Development Intelligence Unit says that the sample achieved included 52.5% male response. It says health insurance coverage is only 50% of the rural households in the country have government health insurance, while 34% lack any health insurance coverage at all. 61% of surveyed households do not have life insurance also. The elderly care, 73% of households with elderly members need constant care, and the majority, that is 95.7%, prefers family caregivers, predominantly female, 72.1%, highlighting the need for caregiver training and home-based care. So India suffers from a severe lack of qualified healthcare professionals in rural areas. Among the states, Chhattisgarh has the highest vacancy of doctors, that is 71%, followed by West Bengal 44%, Maharashtra 37%, Uttar Pradesh 36% in primary healthcare centers. So the overall vacancy for auxiliary nurse and midwives in the country is 5%. If you see the doctor-patient ratio, the doctor-patient ratio in India is approximately 1 is equal to 1,456, which is below the World Health Organization's recommendations ratio of 1 is equal to 1,000. But the situation is worse in rural areas where the ratio is significantly higher due to a shortage of doctors. Government expenditure on health remains low at around 1.28% of GDP. Rural health infrastructure often receives a smaller share of this budget, leading to underfunded facilities. For strengthening health insurance coverage, expanding the reach of government health insurance schemes such as Ayushman Bharat to cover the missing middle, which constitutes around 350 million Indians without access to health insurance, should be done. This would reduce out-of-pocket expenditure and prevent families from falling into debt due to healthcare costs. All factory laborers need to be included under the state-sponsored subsidized health insurance schemes. Missing middle consists of population groups that are engaged in informal sector work and are not poor enough to benefit from state subsidized contributions to insurance premium. So utilize telematics and mobile health clinics to bridge the gap in doctor-patient ratios in rural areas. This can help provide remote consultation and follow-up care, reducing the burdens on existing healthcare facilities. deploy mobile diagnostic units that can travel to remote areas offering essential diagnostic services and reducing the need for patients to travel long distances. Encourage community participation in maintaining sanitation facilities and managing waste. So programs like Swachh Bharat Mission should be strengthened and adapted to local needs to ensure sustainable sanitation practices. So the current status is not very good because the rural India is still lacking the insurance facilities and the various schemes are still not able to provide them the health insurance coverage. This has to be enhanced. This has to be increased because a lot of work has to be done to make the health insurance available to every rural citizen. Thank you very much.